Hi, my name is Dr Tarang K Vora. I'm a pediatric neurosurgeon at Apollo Hospitals, Jubilee Hills, Hyderabad. Today we're going to talk about a very interesting topic, that is brachial plexus injuries in small babies. So what is a brachial plexus birth injury? So generally when a small baby is born, sometimes the nerves or the brachial plexus near the neck gets stretched, and that causes injury to the nerves, which causes weakness in the hands of the small newborn baby. What exactly is brachial plexus? Brachial plexus is a complex set of nerves starting from your cervical spine and extending into your upper arm. So these nerves carry information from your brain and connect it to the muscles of the hand. So whenever the brain is asking the hand to move in one direction or the other, these nerves are responsible for relaying the signal from the brain to the muscle groups in the hand. When these nerves are damaged during the child's birth, it is called as a brachial plexus injury during the child's birth. This injury can happen in adults also and in other age groups also due to a trauma, but it is more commonly seen in children who've had a difficult labor. So what are the types of these brachial plexus injuries? So there are basically three types of these brachial plexus injuries. One is where the nerve is stretched, second is where the nerve gets ruptured, and the third is where the nerve gets avulsed. So stretching basically means that if there is the nerve that is coming from the cervical cord, it is stretched too much during the child's birth, which causes damage to the nerve. Rupture means that the nerve has broken into two pieces altogether, and avulsion is where it has disconnected completely from the spinal cord. So depending on what type of nerve injury it is during the child's birth, the further plan of management is decided. What is Erb's palsy? Erb's palsy is another name for this brachial plexus injury that we see in small newborn babies. So basically it's a palsy in which paralysis of the hand, one hand of the body, in which the child will be not able to lift up his shoulder away, will not be able to flex his elbow, and will not be able to turn his wrist. So child will be having a hand in a very typical position called as the policeman's tip position or the waiter tip position, in which the child or somebody is asking for a tip from behind. So he will not be able to move his shoulder, will not be able to move his elbow, and will not be able to move his wrist, and his wrist will be going on behind. So this is generally seen in newborn babies. As soon as the baby is delivered, it will be noticed by the pediatrician that the child is not able to move his hand very freely. So what are the symptoms of birth-related brachial plexus injury? The symptom is that when the baby is born, the baby will not be able to move. Even if you are pinching the hand, the baby will not be having any sensation on it. So two things, one is weakness in the hand, and second is loss of sensation over the hand. What causes this brachial plexus in birth injury? So there are five main causes of brachial plexus injury in newborn babies. The first is if the baby is very large, so it is difficult for the baby to come out from the mother's womb. When there is difficulty for the baby to come out from the mother's womb, the neck gets stretched too much, and this stretching of the neck causes the nerves to become stretched or avulsed. Second is if it's a breech delivery. Breech delivery is one in which the buttocks come out first during the normal vaginal delivery during the labor. If it's a very difficult labor which has gone on for 10-15 hours, the mother is not able to push the baby down and the baby is stuck in the canal. Fourth is a vacuum or forceps assisted delivery, in which the baby is pulled out. And the last is if it's a twin baby birth, in which two babies are stuck inside the same canal. Basically the only thing that happens during this process is called as the stretching of the nerves in the neck. So if this stretching of the nerves in the neck happens during the labor, this is what causes the brachial plexus injury. Another term for this is called a shoulder dystocia. Shoulder dystocia basically means that there is too much of pressure on the shoulders. So how do we diagnose this? So it's diagnosed based on clinical examination. Once the baby is born, the baby is not able to move his hand, the pediatrician can diagnose it. When do you consult a pediatric neurosurgeon for this? So basically most 90% of these injuries are just stretch injuries. So stretch related injury basically means that the nerve is intact, and when the nerve is intact, over a course of the next 3 months the nerve will start to heal itself. Once it has healed completely, the baby will be able to move his hand again very normally. But in case of a avulsion or a rupture, the nerve will not heal on its own. So if the nerve is completely torn away or ruptured or avulsed away completely from the spinal cord, it will not heal, and it will basically need some kind of surgical intervention to treat the nerve. So most of the babies initially require 3 months of observation. So after the baby is born, for the first 6 weeks to 3 months, we'll look at the baby. There will be some weakness, but which can gradually improve with time. What are the surgical options that we have if the baby is not improving, and if the injury is not a stretch injury but a rupture or an avulsion of the nerve? Then in that case, we have two options. The first option is nerve grafting. Nerve grafting is one in which we take nerve from another part of the body and connect it between the two broken parts of the nerve. And second is nerve transfer, where a normal nerve is transferred from another side of the neck to this side of the neck, so that the electrical supply to the muscle is regained and the muscle will start moving again. It's a relatively easy injury to treat. 90 to 95% of the children improve well over time, and they are able to move their hands well over the course of the next few years. It requires an intense amount of physiotherapy and rehabilitation for the muscles to get acquainted to the new nerves. If you know anybody who is suffering from a pediatric brachial plexus birth related injury, please do consult a pediatric neurosurgeon to find out if there are any other options that can be used to help the baby to move the arm again. Thank you.